What if the reason you wake up exhausted, stiff, and foggy every single morning has nothing to do with how long you slept? What if it has everything to do with how you slept? Most people over 60 spend years blaming age for the way they feel in the morning. The aching lower back, the stiff neck that takes until noon to loosen, the heaviness behind the eyes that never fully lifts no matter how early you went to bed. They accept it. They adjust. They reach for pain relievers before their feet have touched the floor and call it getting older. But research from the National Institute on Aging tells a different story. Certain sleep positions in adults over 60 are directly associated with increased risk of stroke, accelerated memory decline, chronic joint deterioration, and dangerous disruptions to heart function during the overnight hours. And the most troubling part of that research is not the risk itself, it is how completely ordinary the harmful positions are. These are not exotic sleeping habits. They are the positions millions of older adults have used their entire lives without anyone ever explaining what those positions are doing to an aging body during the hours when the body is most vulnerable and least able to compensate. Tonight, I am going to walk you through 4 sleep positions that are quietly working against your health after 60, and 4 that the science consistently supports as genuinely restorative for the aging body. By the end of this conversation, you will know exactly what to change tonight and why that change matters more than almost anything else you could do for your health before you close your eyes. My name is Dr. Williams James. I have been practicing medicine for 25 years, with a significant focus on the health and independence of older adults. Sleep is one of the most underaddressed areas in geriatric medicine, and the gap between what the research tells us about sleep position and aging and what most patients are actually told during routine medical appointments is one I want to close right now. This is not about achieving perfect sleep. It is about understanding what your body needs during those hours and giving it the specific support that makes healing, restoration, and waking up with genuine energy actually possible after 60. Here is something that most people do not fully appreciate about sleep and aging. Sleep is not passive. While you are unconscious, your body is engaged in some of its most critical biological work. The brain clears metabolic waste products through the glymphatic system, a process researchers have linked directly to the prevention of cognitive decline and dementia. The cardiovascular system undergoes its deepest repair cycles. Inflammatory markers that accumulate during waking hours are processed and reduced. Muscle tissue is restored. Hormonal balance is recalibrated. All of that biological work depends on adequate, uninterrupted, properly staged sleep. And research consistently shows that sleep quality in adults over 60 is significantly influenced by position, not just duration. A study published in the Journal of the American Geriatric Society found that poor sleep quality in older adults, defined as fragmented, shallow, or physiologically disrupted sleep, was associated with meaningfully higher rates of cardiovascular events, cognitive decline, fall-related injuries, and reduced life expectancy compared to age-matched adults with good sleep quality. The position your body spends 6 to 8 hours in every night determines whether your sleep is doing the biological work it is supposed to do, or whether it is adding to the physiological burden your aging body is already managing. That is not a minor distinction. That is the difference between sleep that heals and sleep that slowly harms. Before we go through the positions, I want you to understand one foundational concept that will make everything else make sense. Think of the aging body during sleep like a construction crew working the night shift to repair a building that has been in use all day. That crew has everything it needs to do the job, but only if the building's infrastructure supports their work. If the electrical system is overloaded, if the pipes are under pressure, if the structural load is distributed unevenly, the crew cannot work efficiently no matter how many hours they have. After 60, the margin between a position that supports healing and one that compounds damage is narrower than it was at 40. The spine has less cushioning. The cardiovascular system has less reserve. The airways are more susceptible to obstruction, and the joints have accumulated decades of wear that make mechanical stress during sleep more consequential. Let us start with the positions that are creating the most harm. The first position that deserves serious reconsideration after 60 is stomach sleeping. Lying face down may feel comfortable, particularly for people who have slept this way for decades. There is a sense of security and pressure that many stomach sleepers find genuinely soothing. But what feels comforting to the mind during those first moments of settling into sleep is creating a sustained mechanical problem for the body throughout the night. When you sleep on your stomach, your neck must rotate to one side for hours at a time to allow breathing. That sustained rotation places the cervical spine, the neck vertebrae, and the structures surrounding them in a position of prolonged torsional stress. The muscles on one side of the neck remain shortened and contracted throughout the night, while the muscles on the other side are stretched. The nerves that travel through the cervical spine, some of which supply sensation and circulation to the arms, shoulders, and hands, are placed under continuous pressure. The American Chiropractic Association has identified stomach sleeping as the position most associated with cervical misalignment and nerve impingement in older adults. The tingling, numbness, and weakness that many seniors experience in their hands and arms upon waking is frequently a direct consequence of overnight nerve compression from this position. Beyond the cervical spine, stomach sleeping compresses the chest against the mattress, limiting the diaphragm's range of motion and reducing the depth of each breath throughout the night. For an older adult whose lung elasticity has already diminished with age, this restricted breathing means less oxygen reaching the heart and brain during the very hours when those organs most depend on uninterrupted oxygenation for repair and restoration. If you are a lifelong stomach sleeper, the transition to a different position will require deliberate effort and patience. Begin by placing a pillow against your side to prevent rolling forward. Many people find that a body pillow creates enough sense of pressure and contact to make side sleeping feel as secure as stomach sleeping over time. The adjustment takes weeks, not days. But the cumulative benefit to your cervical spine, your breathing, and your overnight neurological health is significant. The second harmful position is the tightly curled fetal position, with the knees drawn up toward the chest. The primary issue is spinal. When the back is held in a tight C curve for several consecutive hours, the muscles and ligaments of the posterior spine are placed under sustained stretch, while the structures on the compressed side are shortened. Over time, this pattern reinforces postural changes that manifest as increased spinal curvature during waking hours, reduced height, compromised balance, and greater vulnerability to falls. Research from spinal health literature consistently identifies habitual tight fetal sleeping as a contributor to the postural deterioration that many older adults attribute simply to aging. The secondary issue is respiratory. In a tight fetal position, the diaphragm is compressed by the proximity of the knees to the chest. Just as with stomach sleeping, this limits the depth and efficiency of breathing throughout the night. For older adults with any degree of chronic obstructive pulmonary disease, reduced lung capacity, or heart conditions that are influenced by oxygen delivery, the cumulative effect of shallow overnight breathing is clinically meaningful. The adjustment here is simple and does not require abandoning side sleeping. A pillow placed between the knees naturally prevents the legs from drawing too far upward and keeps the spine in a more neutral alignment. The body tends to find its own equilibrium at a less extreme angle when the knees have a surface to rest against. The third position is one that was, for decades, recommended as the medically ideal sleep posture: lying flat on your back. The recommendation was not without foundation. For younger adults with healthy airways and good cardiovascular function, lying flat on the back with appropriate head support does distribute spinal load relatively evenly and can be restful. But for adults over 60, lying completely flat introduces two problems that the standard recommendation never adequately addressed. The first is airway compromise. When lying flat on the back, gravity pulls the tongue and soft palate toward the posterior pharynx, narrowing the upper airway. In a young adult with strong airway musculature, this narrowing is compensated for automatically. In an older adult whose airway muscle tone has reduced with age, this gravitational pull can cause the airway to partially obstruct, producing the snoring, choking, and fragmented breathing cycles characteristic of obstructive sleep apnea. The American Academy of Sleep Medicine has established that untreated obstructive sleep apnea in adults over 60 significantly increases the risk of stroke, heart attack, atrial fibrillation, and cognitive decline. Each apnea event, each brief cessation of breathing, produces a drop in blood oxygen levels and a compensatory spike in blood pressure as the cardiovascular system struggles to maintain oxygenation. When these events occur 20, 30, or 40 times per hour throughout the night, the cumulative cardiovascular and neurological stress is substantial. The second problem is acid reflux. When the head is level with the stomach, gravity no longer assists in keeping gastric acid below the esophageal junction. Acid migrates upward, causing the burning, coughing, and throat irritation that disrupts sleep in nearly half of adults over 65. Over years, chronic nighttime reflux causes esophageal damage, affects vocal cord health, and in some cases produces what gastroenterologists call silent reflux, where acid reaches the airways without producing obvious heartburn symptoms. The solution is not to abandon back sleeping entirely, but to modify it with elevation, which we will discuss in the second half of this conversation. The fourth harmful position is one that is increasingly common among older adults managing chronic pain, arthritis, or reflux, and that feels like a genuine solution to the discomfort of lying in a bed. Sleeping every night in a recliner chair. The recliner offers relief from the mechanical discomfort that bed sleeping can create for people with hip pain, spinal arthritis, or significant reflux. Many older adults find that they can fall asleep in a recliner far more easily than in bed, and that they wake with less immediate pain. That short-term relief is real. But the long-term consequences of making the recliner a nightly sleep location are significant and underappreciated. The semi-sitting position of a recliner restricts venous blood return from the legs to the heart. Blood pools in the lower extremities, producing the ankle swelling and leg heaviness that many recliner sleepers notice over time. In more serious cases, prolonged venous pooling contributes to deep vein thrombosis, the formation of blood clots in the deep veins of the legs that can travel to the lungs and become life-threatening. The partially upright position also prevents the lumbar spine from achieving the full relaxation that deep sleep requires. The hip flexor muscles, which are already prone to tightening in older adults who spend significant time seated during the day, remain partially contracted throughout the night, contributing to anterior pelvic tilt, lower back pain, and the difficulty rising from seated positions that many older adults experience. And perhaps most importantly, recliner sleep rarely allows the body to cycle through the deeper stages of sleep that are responsible for the most critical restorative biological work. Memory consolidation, hormonal regulation, cardiovascular repair, and immune system maintenance all occur primarily in the deeper sleep stages that light, fragmented recliner sleep consistently fails to reach. If recliner sleeping has become a necessity because bed sleeping is genuinely too painful, that pain is a signal that deserves direct medical attention rather than accommodation. Speak with your physician about the underlying cause of the discomfort and explore whether a different mattress, a sleep positioning system, or targeted treatment of the underlying condition could make bed sleeping tolerable again. If this conversation is changing how you think about your nightly sleep, I want to ask you to subscribe to this channel right now. Every week I bring research-grounded, honest health conversations specifically designed for adults over 60 who want to age with strength, clarity, and independence. Tap subscribe and turn on notifications so you never miss what comes next. Let me tell you about a patient I will call Raymond. He was 76 years old, a retired civil engineer, and a man who prided himself on his self-sufficiency. He had managed his own health for decades with the kind of disciplined attention he had applied to every project in his career. He exercised regularly. He ate carefully. He took his medications without fail. But for 3 years, Raymond had been waking up exhausted regardless of how many hours he spent in bed. His mornings began with lower back pain that took hours to resolve, a stiff neck that limited his ability to check his blind spots while driving, and a mental fog that his wife described as him not being fully present until well into the afternoon. He had also begun sleeping in his recliner on nights when his back pain was particularly bad, which was becoming more frequent. His physician had attributed the fatigue to normal aging and had suggested he might benefit from a sleep study, a recommendation Raymond had declined because he did not believe his sleep was the problem. When Raymond came to see me, I spent a significant portion of our first appointment asking him about his sleep. Not whether he was getting enough hours, how he was sleeping, the position, the pillow height. whether his wife had noticed any breathing irregularities, whether he woke feeling genuinely rested or simply less tired than when he had gone to bed. The picture that emerged was clear. Raymond was a habitual stomach sleeper who, when his back pain became intolerable, migrated to his recliner. His wife confirmed that his breathing was frequently irregular and that she had heard him stop breathing briefly on multiple occasions over the past year, something she had mentioned to him but that he had dismissed. We addressed three things simultaneously. Raymond agreed to a sleep study, which confirmed moderate obstructive sleep apnea. We worked with his physical therapist to introduce a side sleeping position with a body pillow for support and a knee pillow for spinal alignment. And we identified a wedge pillow system that elevated his upper body at an angle sufficient to address both his reflux and his airway patency without requiring him to use the recliner. 8 weeks later, Raymond came back for his follow-up. He told me that for the first time in years he was waking up feeling like he had actually slept. His back pain on rising had reduced substantially. His wife had reported no further observed breathing pauses. And he had noticed, unprompted, that his thinking felt sharper in the mornings than it had in a long time. He looked at me and said something I hear in some form from almost every patient who makes meaningful sleep changes. He said, "I had no idea I was doing this to myself every single night." Now let us talk about what to do instead. The first and most broadly beneficial sleep position for adults over 60 is side sleeping with a pillow placed between the knees. A comfortable side position, particularly on the left side, offers a combination of benefits that no other sleep posture matches for older adults. Left side sleeping promotes optimal venous return to the heart, keeps the stomach positioned below the esophageal junction to reduce reflux, supports airway patency by preventing the posterior collapse of soft tissue, and aligns the spine in a position that distributes mechanical load more evenly across the intervertebral discs than either stomach or flat back sleeping. The addition of a pillow between the knees addresses the single most common complaint of side sleepers, which is hip and lower back discomfort from the pelvis rotating under the weight of the upper leg. A pillow of appropriate thickness keeps the pelvis level, the lumbar spine neutral, and the hip joint in a position that allows the surrounding muscles to genuinely relax, rather than working throughout the night to maintain alignment. Research from the Cleveland Clinic supports left side sleeping specifically as beneficial for cardiovascular function, lymphatic drainage, and digestive health in older adults. If you currently sleep on your right side and find left side sleeping uncomfortable, the transition can be made gradually using a body pillow to provide the contact and security that makes side sleeping feel natural. The second beneficial position is elevated back sleeping, where the upper body is raised to approximately 30 degrees, and a small pillow or rolled towel supports the knees. This modified back sleeping position directly addresses the two primary risks of flat back sleeping: airway collapse and acid reflux, by using gravity as a physiological ally rather than allowing it to work against the aging body. At 30 degrees of elevation, the tongue and soft palate are positioned forward enough that gravitational pull toward the posterior pharynx is significantly reduced. Gastric acid remains below the esophageal junction, and the cardiovascular system benefits from a slight reduction in the venous pooling that occurs in completely flat sleeping. The knee support is equally important. A small pillow or cushion beneath the knees releases the lumbar spine from the flattening pressure that straight-leg flat sleeping creates, allowing the natural lumbar curve to be maintained and the surrounding muscles to fully relax throughout the night. This position is particularly beneficial for older adults managing sleep apnea, acid reflux, or chronic lower back pain. A wedge pillow designed specifically for sleep elevation is more effective than stacking standard pillows, which tend to shift during the night and reduce the consistency of the angle. The third beneficial position is back sleeping with the arms gently extended to the sides and the palms facing upward, sometimes called the open back or starfish position. What distinguishes this from the rigid flat back position is the deliberate openness of the shoulders and the supported neutral position of the neck. When the arms are not tucked beneath the body or crossed over the chest, the shoulder joints are free of compressive load throughout the night. The chest can expand fully with each breath, and the nerve pathways that travel from the cervical spine into the arms are not subjected to the compression that comes from sleeping with the arms in awkward or confined positions. Research from Harvard Medical School's sleep division has associated this open upper body position with reduced tension headaches, decreased rates of morning neck stiffness, and improved circulation to the cervical and thoracic regions of the spine in older adults. The position also supports calm, deep breathing, which has been associated with lower nocturnal blood pressure and reduced overnight cardiovascular stress. For this position to be effective, pillow support must be appropriate. A pillow that is too high forces the neck into flexion. One that is too low allows the head to fall back. A contoured cervical pillow that maintains the neck in a neutral position relative to the shoulders is worth the investment for older adults using this sleep posture. The fourth position represents what many geriatric sleep specialists now consider the most comprehensively beneficial sleep posture for adults over 60 with multiple health considerations. A 45-degree side recline, where the body is positioned between upright and horizontal on the left side, supported by a firm wedge behind the back, a pillow between the knees, and appropriate cervical support beneath the head. This position combines the circulatory and reflux benefits of left-side sleeping with the airway and cardiovascular benefits of upper body elevation. The spinal alignment it produces is the closest to the body's natural standing posture that any lying position achieves, which means the musculature surrounding the spine can fully relax without the joints moving into mechanical stress. Research published in geriatric sleep medicine literature has associated this position with significant reductions in acid reflux episodes, improved overnight oxygen saturation in adults with mild to moderate sleep apnea, and better subjective sleep quality scores in older adults managing chronic musculoskeletal pain. The setup requires a wedge pillow of appropriate firmness behind the back to maintain the angle through the night, a knee pillow of sufficient thickness to keep the pelvis level, and a cervical pillow that keeps the neck aligned with the spine rather than flexed toward the chest. Once established, most older adults find this position comfortable within 1 to 2 weeks of consistent use. Here is what I want you to do with this information starting tonight. Identify which of the 4 harmful positions you currently use most consistently. That is your starting point. You do not need to change everything at once. You need to understand what your body is experiencing during the overnight hours and make one targeted adjustment. If you are a stomach sleeper, place a body pillow beside you tonight and practice beginning the night on your side. Expect it to feel unfamiliar for the first week or 2. Familiarity is not the same as benefit. If you are a recliner sleeper, speak with your physician about the underlying pain that has driven you to the recliner. That pain deserves direct treatment, not nightly accommodation in a position that is compounding other health risks. If you are a flat-back sleeper, and your partner has ever reported irregular breathing or pauses during your sleep, ask your physician about a sleep study. Obstructive sleep apnea in older adults is significantly underdiagnosed and carries cardiovascular and cognitive consequences that are entirely preventable with appropriate treatment. Invest in the right pillow support for the position you are transitioning to. A knee pillow for side sleeping, a wedge for elevated back sleeping, and a contoured cervical pillow for any back sleeping position are the 3 most impactful sleep equipment investments an older adult can make. They are not expensive, and their effect on overnight physiological restoration is disproportionate to their cost. And finally, give yourself at minimum 3 weeks before evaluating whether a new position is working. Sleep habits are deeply established. The body's adaptation to a new position takes time, and the benefits accumulate gradually rather than appearing overnight. Sleep is not simply the hours between one day and the next. It is the period during which your body does the most important biological work of maintaining your health, your memory, your cardiovascular function, and your independence. What you do with those hours, specifically the position your body spends them in, determines in meaningful ways how you wake up, how you move, how clearly you think, and how resilient your body is to the challenges that aging brings. You have spent 60, 70, or 80 years sleeping in positions that felt familiar. Tonight, you have the information to make those hours genuinely count for your health instead of quietly working against it. Tell me in the comments which sleeping position you currently use and whether you have ever been told by a physician how it might be affecting your health. I read every comment, and your answers help me understand what this community needs most. If this video gave you something useful, Share it with someone you love who is waking up every morning stiff, exhausted, or in pain, and accepting it as inevitable. That share may change how they sleep tonight and every night after it. Subscribe for more honest, research-grounded conversations about what your body needs after 60. Next time, we are covering the 5 nighttime habits that quietly raise blood pressure while you sleep, and most adults over 60 are doing at least 3 of them without knowing it. You will not want to miss that one. Everything shared in this video is general medical and health information based on published research and clinical experience. It is not personal medical advice and is not a substitute for care from your own physician. Individual health situations vary significantly, particularly for those managing chronic conditions, cardiovascular disease, sleep disorders, or musculoskeletal injuries. Please consult your doctor before making significant changes to your sleep routine or positioning, especially if you are currently using a medical device, such as a CPAP machine, or managing a condition that affects your mobility or circulation. Your physician knows your full picture. Work with them and sleep well.